Good afternoon. Thanks for joining us Across the Fence. I'm Fran Stoddard. Everyone ages differently, but as we grow older, we can often experience medical issues that grow increasingly more complex. When that happens, a doctor who specializes in caring and treating older adults can help maintain wellness and independence. This is especially important in Vermont, where nearly 1 in 5 of us is over the age of 65. So today we'll be talking with 2 guests from the University of Vermont Medical Center's Division of Geriatric Medicine. Amy Gennari is the division's Associate Chief for Clinical Affairs, and Valerie Adams is a geriatric nurse clinician. Thank you both for joining us.
Thank you. Thank you.
So one of the things that we'll discuss this afternoon is a new geriatric inpatient consulting consultation service at the medical center. But before we do this, I want to make sure that we understand all the terminology that we use today. So Dr. Gennari, would you please just define geriatrician or geriatric specialist?
Sure. So a geriatrician is someone who's already gone through either internal medicine training or family practice training, and then does an additional 1 or 2 years of specialist training in the care of older adults. What I like to emphasize here is that it's not just about seeing patients that are over the age of 65. It's really about caring for the very, very complex patient. Someone who might be very frail, maybe is having frequent falls, someone who has Alzheimer's disease, and maybe there's an issue with not enough caregiver support. We like to focus on the whole patient and really think about what matters most to the patient and their family members. And we want to really focus on trying to keep the older adult functional and as independent as possible.
So how would someone know when to see a geriatric specialist? Would this be a referral from a primary care provider usually?
Sometimes we certainly get referrals from primary care providers. We also often have families self-refer their loved ones when they start to see that maybe they're struggling or are having a lot of complicated medical issues. And then sometimes we get specialists, other specialists referring to us, like orthopedics or cardiologists.
Okay. And I mentioned that the medical center now has an inpatient geriatric consult service. So what does that mean?
So this is a new service for the University of Vermont. I think what I need to answer that, I need to just sort of talk to you about the mission of the inpatient consult service. Our goal is to help the primary team with those complex patients to help reduce and prevent hospital-related complications, including functional decline, delirium, which is an acute confusional state, which we'll talk about a little bit more, falls, poor nutrition. So we're trying to integrate the plan with what matters most to the patient and their families. We assess cognition, manage medications, and help with the transitions of care once they're ready to leave the hospital.
So who would be members of the consult team?
So we have several geriatricians that rotate a week at a time on the service. We're also a teaching service. So we have learners, we have residents, and nurse practitioner students. And then we have our geriatric nurse specialist, Val, who I'll let take it from here.
Val, go ahead.
Yeah. So my role as the geriatric nurse clinician is I do a lot of education. So I do a lot of education to the patient and to their family members about what delirium is, what are the hazards of hospitalization. I also partner with the staff nurses on the unit to develop a plan of care to integrate those different areas that we're really focused on for the older adult. We also have a geriatric pharmacist, Doug Franzoni, who is wonderful at helping us navigate complex med lists and identifying high risk medications and their dosings. And he's helped supports with deprescribing. So if there's questions about what maybe are the most important medications to get rid of first. And also he helps navigate the cost of medications, which is very important to families and patients.
So what kinds of patients are you typically seeing for that service?
Right now, we're focusing on patients on the general medicine unit. There might be patients that come in with a fall, or they come in with confusion at home. Um, we often see patients with end-stage Alzheimer's disease that might have behaviors that are really challenging to manage. And medication patients that are on way too many medications. Sometimes we see patients at the request of families, especially if we're needing to have complex conversations. And to that end, we also have a chaplain on our consult team, Rick New, who helps us a lot with those types of conversations.
Are there hazards for hospitalization for elderly patients in particular?
Yes, unfortunately, there's a lot of hazards of hospitalizations, and it's very, very common in the older, frail adult that they might suffer some of these complications. The issue is, as you get older, even if you're relatively healthy, you don't have as much reserve. So someone who's 20 years old, if they get acutely ill, they can bounce right back. But in the older adult, even a minor insult can cause problems. So, for example, if you're in bed with an acute illness for even a day, you lose muscle mass and function, and also your brain has less reserve. So if you end up getting a medication that gives you a side effect, you might get acutely confused because your brain just can't handle it anymore.
That must be tough for the nursing staff as well, Val.
Yeah, so the hospital environment is a new environment to people. So that's a big hazard for hospitalization. You don't know where the location of the bathroom is. You're tied down to an IV pole or something else. You don't know where the bathroom is, and there's clutter. Also, it's hard to sleep in the hospital, and there's lots of noise and interruptions to your sleep. You're also unfamiliar with caregivers, especially if you have caregivers at home that are providing support. You don't know who these nurses are, and just a general unawareness of your deconditioning. So I may be able to get up and be fine at home in the middle of the night to go to the bathroom, but because I have deconditioning, I try to get out of bed by myself in the middle of the night to go to the bathroom, and I'm a higher risk for falling at that point.
So I guess delirium is a real problem with the elderly. Who's at risk for developing that?
Yeah, so delirium is a temporary state of confusion. That's a change from someone's baseline. And it really causes a lot of clouding of thought, makes it harder to pay attention to what's going on, difficult focusing your attention. It develops really quickly over a matter of hours to days, and it can last for a few hours to days, but it also can linger. So once somebody becomes delirious, it's really important to treat that right away and identify it. So people that are at risk for getting delirious are the patients that are older than 65, and they have usually another risk factor, such as a baseline dementia. They may have issues with their own function, needing a walker or a cane. They also have vision and hearing problems. They may need glasses or hearing aids. They may be at risk for dehydration or poor nutrition. They're also taking multiple medications, and also having those more complex multiple medical conditions, or just having surgery.
Right, so there's really a lot going on. What can patients and their families do to help with delirium and functional decline while their loved one is hospitalized?
Yeah, so communicating with your care team is really important. Having the care team have an understanding of what someone's baseline is, both functional status and a cognitive status, so that we can identify any changes that might happen. Thankfully now, with restrictions coming up, loosening related to COVID, family members being at the bedside is really important, and having them provide gentle reorientation to situation, place, time, making sure their loved ones have their hearing aids and glasses. Don't take them home, please keep them in the hospital with them. Encouraging mobility, getting them up and out of bed to the chair for their meals, encouraging a walk in the hall if that's able. Bringing familiar objects from home, all those things are really important.
So keep them moving around, and so creating that space and helping them understand that space also, I would think is important.
Definitely, for sure.
So Amy, we're all told to carefully review our medications, and that's not always an easy task. I remember doing it for my mom, and it's very complicated, and multiple medications can be involved. Can you address why it's important to review medications, and what's the best way to do that?
Absolutely. It is a critical issue, and a lot of older patients are on a lot of medications. So the issue becomes a problem because the more medications you're on, the more likely you're to have drug-drug interactions, and the more medical problems you have, it's also more likely that those drugs are going to cause problems. So, for example, if you've got some cognitive impairment, there are medications that you might have been able to take, years ago when you were 20 years old, but now those same medications are going to cause side effects and problems. Same thing as if you have, let's say, some issues with your kidney function. Medications that were safe before are no longer safe. So it's important to look at every single medication and try to assess the risks of those medications versus the benefits of those medications. And again, taking into account what matters most to the patient and also their life expectancy, because some medications benefit patients in 10 years and other medications benefit you right now. So all of those things need to be taken into consideration with each medication, one by one, going through the list.
Go ahead. That's
I
part
was
of what
going
the
to say
consult
that we
does.
need our pharmacists to help us with this. So it's very, very important to have your pharmacist as part of your medical team to help sort this all out. It takes a lot of time, but it is incredibly important. And the rewards are very rich because when you peel away medications that maybe weren't really helping you or maybe were actually hurting you, you get a real benefit right away.
So quickly, just a few seconds left. What about the transition from the hospital back home?
Yeah, there's a lot of pitfalls when we transition from the hospital back home. And one of the biggest pitfalls is, in fact, the medication, because we change medications in the hospital and then patients go home and they see their old medications and they get confused about whether or not they should be taking both of them or go back to the old ones. So again, we use our geriatric pharmacist a lot to help us make sure that the patients understand the medication changes, that the new medications are accessible and affordable to them. And Val, I wanted you to speak
Amy,
for real quick.
Well, I'm sorry, we're all out of time, but
Okay.
check into all of these things. They're very important. Thank you so much for your service. Dr. Amy Gennari and Valerie Adams, thank you so much. And thank you for joining us across the fence. I'm Fran Stoddard. Stay well.